What is expected of the parent and what is expected of the child in terms of diabetes management is very dependent on the age of the child and the skill levels of your child. So, for example, a 4-year-old might be perfectly capable of saying, "Hey, Mom, would you please, I prefer that you check my middle finger as opposed to my pinky finger." And they might be allowed to choose which finger to check their blood sugar in. They might be able to actually use the little finger pricker to prick their finger, but they don't have the math skills to understand that a blood sugar of 300 is much, much higher than a blood sugar of 100 typically. On the other hand, an 8-year-old or a 9-year-old certainly is capable of recognizing the difference between a blood sugar of 100 and 300, is certainly capable of helping make some decisions. Again, the decisions are often things like what food they would like. They have counting skills, so often they can help make decisions about how much food they're going to ingest. Usually by the time children are 10 or so, we begin pushing the child to take more ownership. And by that, I mean that the children may begin to be able to draw up the insulin to give an injection, or with adult supervision, actually give the injection themselves. It's important to remember that when children are seeing these activities done 3 or 4 or 5 times a day, in a year that means they're exposed to 1,500 blood checks, they're exposed to maybe 1,000 insulin injections. So, if you see something demonstrated 1,000 times, hopefully you get pretty good at least understanding mechanically how to do it, even if you don't have the necessary math skills to understand how the decision making goes about how much insulin needs to go with how much food.